Many young women are getting Botox even before their wrinkles are really visible. Is this really necessary? Here to give us more insight on the Botox craze and how more men and even young women are getting it is Dr. Doris Day, author of the book Forget the Facelift. Welcome, Dr. Day.
Thank you. Thanks for having me.
Well, this is an interesting topic, and I guess the first question I want to ask you is, and you may not have this statistic, how much money are we spending each year as a country on Botox and Botox injections?
I don't have the answer in terms of numbers, but it's in the millions to possibly billions.
That's a lot of money on Botox, which then brings us to our question of younger women getting Botox. And I have to say, when I heard about this, women under 30 getting Botox, my initial response was, we really don't need to be spending our money on this. Are we giving young women wrong information? What do you think about this?
Well, I think when somebody comes into my office and they ask me about Botox, I think of it as an opportunity to educate them on different tools we have. And I don't look at their age when they come in, I look at their facial expressions and how appropriate they are. Botox is one of our best tools to help people have natural expressions and to continue to have expressions but that are appropriate. So when I see somebody who, let's say, is 28 or approaching 30, and they come in and we're having a conversation about something that is interesting to them, and I see that they're furrowing their brows and they're animating in one expression to show me that they're listening, but it makes them look very angry. Botox used appropriately right there between the eyes can soften that expression, and actually I can help re-educate them on all the other muscles they have available in their face, and then they don't have to continue doing Botox over time. It becomes a form of training wheels, and you break a bad habit early. And there are studies that show that when you make that expression, you actually create the emotion that goes with it. So when you furrow your brows and you frown, you actually feel more angry. So when you teach people and help them learn not to make that angry expression, they actually feel happier, they have better interactions, they actually make better decisions, and they don't have to keep doing the Botox. That's a completely voluntary expression that you can help someone learn to not make all the time, and then they don't have to continue with the Botox.
All right. So I'll buy the, and I'm being very careful here not to make my brow move at all when I'm talking to you, because I know you're watching. And I'll buy the argument that retraining them how to use their facial muscles makes sense. But what I have found from people who I know is that once they kind of get hooked on the Botox train, they're kind of on that train for years, or many years, or forever. So what you're saying is that it's kind of one and done. That's not been, I think, the experience of many people that I've interacted with. So am I seeing a different proportion of the population, or is what you're telling me more accurate for what most people do?
You know, education is very important. We live in a society of a quick fix. We want a medicine for our blood pressure, our diabetes, our everything, to sleep, to wake up. So there is a lot of education that's involved. And my goal in treating my patients and my goal in writing the book is really to show people that you have a lot of really great tools. A tool that's not used properly, or somebody who wants to count on that tool instead of using their own body's natural abilities, that's where, as a physician, I come in to help re-educate and redirect that person. And I find that when I can get somebody who is around 30 or even a little bit under 30, and I can help teach them about proper sun protection, proper diet, exercise, getting enough rest, managing how much alcohol they have, how much stress they have, I find that I really don't have to do a lot of things, and I am saving them from doing a lot of other cosmetic procedures down the line. So I'm truly helping them age gracefully, as opposed to helping them not poison themselves. And I find that that's a very powerful age to reach people and to get them before they get too far ahead.
Fair enough. I want to get one more question in before we run out of time here, and that's the issue of men. And there's been some talk about different people, Joe Biden having Botox, men having Botox. Are more men getting Botox, and do they need it?
Well, men are getting more Botox. I don't think they need it as much as women do. A lot of wives are bringing their husbands in, and sometimes husbands bring their wives in. But you have to be very careful in men, because women can have a little lift of the brow, and that looks good. In a guy, it's not quite as appropriate. So you have to be very, very careful in how you do Botox in men. They're getting it more than they used to, but they have more time in between sessions. So it is a really great, very powerful, very natural tool that we have to help people express more appropriately, age more gracefully, and stay looking fabulous over years.
Well, Dr. Day, thanks. Really interesting discussion. I'm sure we'll have more to say about this in the future.
Thanks for having me.